Next, we have Patrick Keenan from Pennsylvania Health Access Network.
So good evening, everyone. It's been an interesting 24 hours in health policy, as all of you have been glued to the TV. So this, what I'm about to say is kind of changed over a couple of hours, and there may be more news that have come out, recently, besides the president's really abhorrent statements that, we should just let the entire thing fail, and then be 32 million folks without coverage, so that Democrats have to work with the administration. But what I want to say really clearly is no matter what is happening, I think the senator was absolutely correct that this issue is not going to go away. We have a couple of key touch points to kind of look at, both even after the legislation fails. If Majority Leader McConnell, we heard he might try to bring the repeal, the full repeal without a replacement to a vote as early as Thursday, but possibly next week. And even if that doesn't happen, even if that vote fails, what we know is that healthcare is not off the chopping block, that none of the programs that we care strongly about are safe at this moment. So I want to kind of review some of the things that we see happening in both DC and in Harrisburg that really kind of threaten the security of our healthcare safety. The first is, the point about sabotage, and I really appreciate what Representative Delissio said. Even during the Obama administration, sabotage was happening to the Affordable Care Act during President Obama's watch. The Congress refused to appropriate the full amount of money that was designed to offset big losses within insurance companies called risk corridor and risk adjustment payments. We also saw this constant battle around cost sharing reductions, and I think that that's the thing that many of you have heard on in the news. The president keeps on playing a game of chance with cost sharing reductions, which if he chose not to make those payments because Congress has not fully appropriated them, even though they were in the Affordable Care Act, that could have some of the most devastating consequences to the insurance markets, because those are the payments that make care more affordable when people actually need to go to the doctor and are faced with a higher copay. So we know that the sabotage has been happening. We know that the administration has been playing chicken with the cost sharing reductions. And we also know that there's several things that they've already done that begin to kind of poke holes in the Affordable Care Act, even without action by Congress. The first is that, the president's, one of his first acts was to instruct the IRS not to enforce the individual mandate. And when you think about the architecture of the Affordable Care Act, the individual mandate, the requirement to have health insurance or pay a penalty, is a really important piece, because if you're going to guarantee the rights of pre-existing conditions and that everyone gets access to health insurance, you also need to have two other pieces. One is the financial assistance, which the president, through the cost sharing reductions, already is threatening to tamper with. But then the third leg of that stool is the individual mandate that requires healthy people to obtain health insurance or face that penalty. We already know, and unfortunately good data right now is not available from the IRS, no surprise there, as to how much their lack of enforcement on the individual mandate has had. But we know, based on our own state, our own insurance commissioner, that if the individual mandate was pulled out or not enforced, that insurance companies would see 20% rate increases above what's being proposed right now, which is 8.8%. So we would see more than a doubling of the rates in the individual insurance market if that wasn't enforced. The other thing that we know is that the president has, the opportunity to pull the rug out on the outreach and enrollment that's done to get healthy people into the plans. And so that's something that he could also do administratively in this question as to whether or not, he's actually going to continue to do the marketing. We saw him, try to pull it in the last days of last year's open enrollment. There's no reason why he wouldn't go after that in this upcoming open enrollment period. So the president already has the tools at his disposal to make the Affordable Care Act, in many ways implode. When, quite frankly, you could turn to our own insurance commissioner. It is not in a death spiral. We are not, the talking points that we hear about in DC are simply not happening here. The other thing I want to say is that Medicaid and some folks from the Partners in the Healthcare Defenders Coalition will be coming around to pass out postcards in support of Medicaid. We would really ask you, first of all, to fill them out and express your support for Medicaid, because we're going to be delivering them to members of the various congressional offices. But Medicaid is deeply at risk at both the federal level and at the state level. What we know is that even without the passage of the legislation through the Senate or through the House, the Trump budget is dependent upon making deep cuts to the Medicaid program, deeper cuts than were proposed in both the House and the Senate bills. So the math is simply not there to fund the president's agenda without going after Medicaid. Many folks may be saying, why do I care about Medicaid? Why is that important to me? I've got private insurance or I'm on Medicare. The reality is that if you live long enough, you will find yourself on Medicaid. Medicare does not pay for home and community-based services. There are a lot of circumstances in which members of your family, if they were to lose their job, especially in that 55 to 64, those pre-Medicaid years, they need the Medicaid expansion to be there for them. Children with disabilities, overwhelmingly rely on Medicaid to get the kinds of coverage that they need. Medicaid is deeply at risk, and I said it's both at the federal level and at the state level, because we saw, just last week, the House Bill 59 go after Medicaid and try to erode Medicaid protection here in Pennsylvania. This was really pushed by the House Republicans, and it would really impose higher cost sharing on Medicaid recipients. If they're enrolled for children with disabilities, they've set the eligibility level of this higher cost sharing level at a really high level, 1,000% of the federal poverty line. But what we know is that that's simply a gimmick, because we know that children with disabilities, they set it at 1,000% this year, and next year and the year after, they slowly chip away with that. They're also imposing work requirements based on a fantasy that people in Medicaid aren't working. The reality is, in Medicaid expansion, 58% are working themselves, and over 3/4 of them are in working households. So what that means is they're often children with working parents, that are 22 years old, or they're that spouse that had to take early retirement because their job ended and they can't get other kinds of employment. So folks in Medicaid overwhelmingly are working. The last thing that they want to do is set lock-ins in Medicaid plans, which seem reasonable, but the problem is they're not actually a solution, because less than 1% of Medicaid enrollees actually change their Medicaid plans, and it's only because they have unmet health needs by their current Medicaid plan. All of this would create huge bureaucracy, but it's really designed to attack the fundamental framework of Medicaid and people's ability to get health care. And that bill is sitting right now in the Senate Rules Committee, and we're waiting to see it's actually part of the budget process. So if you haven't already done so, please, when you go home tonight, don't email, call your state senator and make sure that they know that you oppose House Bill 59. And they'll tell you that it was already passed out of the Senate. It's been radically hijacked by House Republicans to oppose these changes. That's not the only bill. Right now we can count about 6 bills sitting in Harrisburg right now that are designed to radically restructure Pennsylvania's Medicaid program. And all of them, if they don't currently come to a head in this legislative session, are really being used as talking points for the upcoming years. And again, these are things that all of you have direct contact with your lawmakers, two of whom, both at the county and the state level, are sitting right here. So it's really important that we don't just watch what's going on in DC and forget about what's happening in the southern part of the state. The last thing I want to leave you with, because I know I've already extended my time to talk, is that many of you, and we all have applauded the efforts that the representative has put forth, to try to make a more equitable, fairer healthcare system for everyone. I want to leave you with this note. Here's why Medicaid is so important that we protect what we currently have while working towards broader visions for healthcare. 1 in 2 insured Pennsylvanians are currently in a product regulated by the Centers for Medicaid and Medicare Services. Over half of Pennsylvanians are either on Medicare, Medicaid, or the individual marketplace. So if we want to see universal health care or broader expansion of the health care that we already have, it's vital that we protect the programs that we have right now so that we can get to that broader, issue. And there's really common sense approaches. Negotiating prescription drug prices, would be one of them that could easily be, not easily, but that could be done to contain healthcare costs. Funding, the parts of the Affordable Care Act that are always designed to keep the costs down would be really important. Making sure there's an appropriation for the cost sharing reductions. And if we're really worried about those folks 55 to 64, we could always work on changing the Medicare eligibility range so that we have a healthier risk pool and that those folks actually end up, getting the kinds of care they need. We could promote a basic health plan. There's tons of really good policy solutions out there, but we can't let go of Medicaid and Medicare too, as we watch other kinds of things happen. So thank you for your time.